Good evening. This is my second interview with John Fratty. The first interview we spoke about your experience and background as a former pharmaceutical sales rep, and now we're going to be talking a little bit about your experience and knowledge with regard to the FDA and the service it provides and the service it's supposed to provide, and if they're one and the same thing or not. The reason why I'm speaking with you is because as a pharmaceutical sales rep, I would imagine that you have more knowledge on the FDA than 90% of the population, and that's probably a small number. I would say maybe even 98% of the population, and even more than doctors do. Probably doctors treat patients. You deal with drugs, and it's the FDA's job to monitor. Well, you're going to tell me what the FDA's job is, because this is going to be an education for me, and it's going to be an education for everyone who watches this interview. The first question is, what does the FDA stand for, and how long ago did it come into being? And some of these questions you may or may not know the answers to. I'm just throwing them at you, and if you don't know the answers to some of them, please don't feel bad. These are thrown off the cuff, and so whatever you can answer, Healthcare TV is extremely grateful for. So first of all, do you know what the FDA stands for?
The Food and Drug Administration.
And when did it come into being?
I don't know the exact date in terms of the exact year, but
right.
it's been in existence for a very long time.
Okay. And what part is the food part? Is that like to check if certain foods are safe to eat?
Yeah, certain food additives, say for instance aspartame in
right.
diet soda, different types of fillers in different foods, things like that. Yeah.
Okay, and is it safe to say that the food part of the Food and Drug Administration is a very, very small percentage as opposed to the work it does with regard to drugs?
Yeah, I don't think it's a very small percentage. It's a smaller percentage than the efforts the company, no, not the company, the efforts the Food and Drug Administration puts forth in terms of their work in regards to drugs.
Okay, so what you're saying is the food is not just a very small percentage. There is more to it than most people would imagine.
Right.
But,
right.
Okay, thank you very much for that. But we're going to concentrate on tonight the drug side of it. Mm-hmm. For those who watched our first interview, they'll remember that that we spoke a lot about your day-to-day job as a pharmaceutical sales rep. What is the process with regard to getting a drug released on the market?
Well, the process, it's a lengthy process. What happens is the pharmaceutical company has a drug that's going through their clinical trials, and once it's gone through their trials, they publish data about the drug, and that data gets submitted to the Food and Drug Administration for review. I think a lot of people think the Food and Drug Administration does their own studies about drugs, and that's not the case. The FDA doesn't do any studies on any drugs. It relies on the pharmaceutical companies that are trying to get these drugs approved to do their own testing to get approved. And in that case, in many instances, there's an inherent bias because it's left to the pharmaceutical company to publish the data to get a drug approved.
So this data really can't be challenged because they can put in whatever they like, really, and it's submitted to the FDA, and the FDA then makes a determination based upon data given to them.
Right. But these studies are done. They're randomized. They're placebo-controlled. They're double-blinded studies to try and give it as much accuracy as possible.
Right. So you don't think there's any funny games that pharmaceuticals play as far as if there's some really bad reactions from some people that they hide that data. None of that takes place.
Some of it does take place, but
It does?
It's probably not as bad as what somebody would think, because if they're trying to get a drug approved and if they see in their clinical trials that it's causing a lot of harm, they don't want to bring forth the drug in that case because it would open themselves up to a lot of criticism, potential lawsuits,
right.
just a myriad of problems.
Right.
So a drug has a certain acceptable limit of safety, and if the drug meets that level, whatever that level is defined by the company, then it gets submitted to the FDA.
Right, but as far as the company's saying, you know what, this particular drug, the trials have been extremely successful, and there has been some extremely bad reactions as well. Let's hide that information and just submit to the FDA the good stuff. Do you think something like that happens?
It can happen in the sense that what they can do is if they put forth this information to the FDA and some of these reactions, like you're mentioning, come forth in their studies, they can shorten the length of the study and say that, okay, instead of saying we studied this drug for a year, we can say we studied it for 9 months, and maybe some of those reactions that occurred from the drug occurred after the 9-month period. We don't necessarily have to include that.
Okay, so there's manipulation.
There's ways to kind of manipulate the system very subtly.
Right. Do you think that's rife from the pharmaceuticals end when they submit, or it's not a common practice to manipulate data?
I think some of the data is definitely manipulated, but not to a tremendous degree.
Okay.
But it does go on.
Okay,
sure.
But mostly you reckon at this stage of the game, pharmaceuticals try and play fair as far as the data that they submit, at least in that sense.
Right.
Okay.
Right.
Fine. My next question is, with regard to the relationship between the FDA and the drug companies, would you say it's a healthy relationship?
For the drug companies it is, and I never knew that as a pharmaceutical rep. I always thought the FDA was an organization that was somewhat anti-pharmaceutical. I thought they were very tough, very stringent. They just made sure that every single drug, was very safe before they allowed it on the market, and that's not the case. This is a quote from the former FDA commissioner. He said, "What the FDA actually does and what the public thinks the FDA does is as different as night and day."
And this is the former
FDA commissioner.
Is that like the top